My name is Jonas Ludvigsson and I'm Professor of Clinical Epidemiology at the Karolinska Institutet in Sweden and a pediatrician at the Örebro University Hospital. I've been asked to shortly comment on our editorial about amount of gluten introduction and the risk of celiac disease, a paper published by Aronsson et al. Well, celiac disease is a lifelong immune-mediated disorder that often occurs in children. Early research has pointed out timing of gluten introduction and breastfeeding duration as two critical factors for the risk of celiac disease. However, two recent papers, randomized clinical trials in the New England Journal of Medicine, found that perhaps the timing of gluten introduction and breastfeeding duration are not as important to celiac risk as we previously thought. Hence, we're now looking for the other factors in addition to the genetic setup, which is necessary to develop celiac disease. Now an exciting paper has come out of Sweden where the authors have looked at the amount of gluten in the infant's diet. As a pediatrician, I encourage a gradual food introduction of all kinds of foods to infants, and that applies also to gluten. In the paper by Aronsson and co-authors, they found that high amount of gluten is associated with an increased risk of celiac disease. However, what is interesting is also that in early infant life, say at 6 months of age, 9 months of age, the association is not so clear. Hence, it is a bit difficult to say how does this study actually influence our guidelines about infant food introduction. I'm not really sure about that, but I hope that the authors, Aronsson et al., will produce more data from the TEDdy study, including American data. Perhaps that will settle our questions. Thank you very much.